Hi, my name is Bob Meyer. I'm with the Christian Dental Society and would like to explain the operations and functions of the Aseptico Task Force Dental Operating Unit, which is a portable dental operating unit, which we rent out through the Christian Dental Society. We normally carry it in a Sears portable rolling box to protect it during the airport handling. To open the unit, we usually put a strap on it just to protect it from being opened by the baggage handlers. The unit opens. Usually have a couple boxes of gloves because the unit weighs 33 pounds and with the box it weighs 45 pounds. So you have about 5 pounds of extra baggage or weight you can put on. Usually a couple boxes of gloves works real good. Then the dental operating unit comes out. It works really good to use the box to set the unit on because it puts it at the perfect height for working. Now, this dental operating unit is self-contained, contains high-speed, low-speed handpieces, the air water syringe, and a suction. And it works in 120 volts, which is American voltage, or 220, 240 volts, which is the international current in many places. To change between 110 and 220, you have to go to the back and change the fuses in the adapter. And this is in the instruction manual, which comes with every unit. But just to show you, you can take a pen or a little knife and just open this unit up, and you've got the fuses right here. And I'm not going to tell you which fuses go with which because you won't remember it because they're in the instruction booklet. But there's a little thing here that's a switch that goes between 220 and 120. Because this unit's going to Uganda next week, and Uganda is 240 power. We put the 240 side out, which slips right in there. And there's a little window here. If a fuse comes out, you just put it right back in. The two little fuses go in here. And then you can see when this goes in here, you see the 240 back there. So that's how you change the unit between 120 and 240. So you can take this to two different countries with two different currents and use it either way. Now to open the unit up, you just unsnap it and it comes open. And one of the first things you'll find is the suction hose, which is the suction hose. You set that aside. Then you're going to find three hoses coming out of the unit. One is the high-speed handpiece, one's the slow-speed handpiece, and one's the air water syringe. You just kind of untangle them so that they don't get all mixed up. And the air water syringe for your assistant usually goes on the left side, so I put that over here. And the high-speed and low-speed handpieces, those are mine, so I keep them over on my side. And then what you'll find is you'll find a cord, which most often it's the normal plug-in for American plug-ins. But I'm going to Uganda, so I need a special adapter, which is a different type of plug, which is a triangular, rectangular plugs that plugs into the Uganda electrical outlet. And then this just goes in the back next to the fuses and plugs in. You plug that into the wall and you're ready to go. The next thing you'll find in there is your foot control. The foot control turns the unit on and off. When you step on the foot control, the unit goes on. When you come off, the unit comes off. There's no in between. And you'll find a bottle for clean water. I usually put bottled water in here or clean drinking water because this runs the air water syringe and the water in the high-speed handpiece. So you just put the little blue tube in here and you screw it on and you got your water. The other thing that's in here is for your suction, your reservoir for your blood and saliva, etc. It just screws on. There is a shut-off valve here so that if this bottle gets full, the shut-off will shut the unit off so you don't contaminate your unit with all the extra blood and saliva. Now the hose that we took off here for the suction hose fits right on here in this little connector. You just push it down a quarter turn to the right and it hooks in there. Then you take it and it'll hook right on the unit here. There's a little rubber O-ring here, and it just snaps right on and comes off. So this goes down here and just snaps on. Now to get the unit functional, this lid has to come down about halfway, and there's this little connector here that goes on the side, and it's in your instruction manual, but this just goes on here like this, sits right in here, and this snaps on here, and that holds the top solid. And then I put the hand pieces on, and they're easy to get tangled up, so you just want to make sure they're not too tangled up, just to make it easier on yourself. So that they go, and then you can put the hand pieces up, but you chance jabbing yourself with a contaminated burr. So I always put the hand pieces down, and it's just safer that way to keep them down. And then your assistance on this side with the air water syringe goes here, and the suction can go right here, and you're ready to go. Now you've got a number of switches up here on top. This lower switch is a universal quick disconnect for water. You put a Caviton unit on here, or ultrasonic or piezoelectric cleaner, but you don't really use this for restorative dentistry. The two switches on this side control the hand pieces. There's a high and a low on here, which control your high speed and low speed hand pieces. So both hand pieces won't go on the same time. They're controlled by this high speed or low speed hand piece. The other control here shuts the hand pieces on and off. Because when you step on the foot control, the suction always goes on, and if you have the hand pieces on and you have the high speed on, then your high speed hand piece will be on. But if you don't want the high speed hand piece on because your assistant's just suctioning, or you're doing a lot of surgery and you don't want the hand pieces to be turning, turn this off. When you step on the foot control, you got maximum suction. The other control you have here is for your water control on your high-speed handpiece. You can either turn the water on or off on your high-speed handpiece, and then you control the volume of water in your handpiece. And the handpieces are a normal 4-hole connector. So now you're ready to go with your unit. Now where do you place the unit? So the question is, do you place it on the right next to the dentist, or do you put it behind the patient? I have found for the assistant that it's better to place the unit right behind the patient, so that the assistant can work on one side and has got access to the air water syringe and the suction, and then the dentist can sit on one side and he's got access. Now we use this chair here in the Christian Dental Society because it's a portable, easy to carry chair. Takes me 5 minutes or less to set up once you learn how to do it. And 2 chairs will fit in this box right here, which I use as a stand, and you can carry it on the plane. And I've had 400-pound patients on that chair, so that's a good chair that you can rent from the Christian Dental Society. The other thing that's handy to have is a doctor's stool. And I like one with a head with a backrest, and these come from Camp Time, and they're very lightweight, portable, and they're very comfortable to sit on the chair. So I'll sit like this on the chair. I've got the foot control right down here by my feet. I can take the hand piece. I've got this set here for my instruments, and I can work either on one side of the patient's head, or I can go on the head of the other side, whichever is most convenient for you as the dentist. I've done it both ways, depending upon where I'm working. But you can work the high speed, low speed. Remember, you switch the control here off. You can bring this, around where it's comfortable for you, but you basically can do state-of-the-art dentistry without killing your back with this setup right here. So that's how the unit works. Now to get the unit down, or to pack it up, what you do is you suction water through the suction hose to clean the hose out. And if I haven't mentioned so already, when you're doing surgery, this hose, which is fairly small, will coagulate with blood. So we take a container, this is just a cottage cheese container, and fill with water and have it near so the assistant in the middle of a bloody surgical procedure can suction some water through this hose to keep blood from coagulating, and at the end of the procedure suction more water through it so that this hose doesn't get contaminated with coagulated blood. And then at the end of the day, suction more water through it so that the hose is clean. So once the hose is clean, you disconnect it. You take this, as we mentioned, you dump it, and then I leave this open so that it doesn't dry out and mildew. Then you disconnect your little connector here. Don't lose this little piece because it's a hybrid. It fits right in here and it stays there. Then you got all these hand pieces and hoses. And what I do with those, the 3 hoses, is I will pack them up in just a minute. Set those aside. Because I want to take the water bottle and unscrew it and dump the water out and leave it open so it airs out and the water doesn't mildew. Okay, then you can take your hoses and basically I put them right in this reservoir here in this half that's open, and I figure 8 them in there. So I take all 3 hoses together and I just figure 8 them inside the box. Otherwise they just get all tangled, and most of the time I'll leave the hand pieces on if they're clean. Now the hand pieces you can take off and sterilize if you've got enough hand pieces, and especially if they're contaminated. If they don't get very contaminated, sometimes you can disinfect them, but you're better off if you've got the hand pieces to sterilize the hand pieces. But most of the time after I sterilize the hand piece, I'll put them back on and I'll put them back in the unit so that I'm ready to go for the next patient. I don't have to rehook hand pieces up again. And the air water syringe is the same way. You can change the tips on here, on the air water syringe tips. You can even put disposable tips, or you can just disinfect the tips between patients. But I usually leave those hooked up. So once you have that wrapped up in there, then that just stays there. Then you take the foot control, and that will just sit down in there and wrap up and go down next to the bottles that you have down here. Then I'll take the cord that you don't want to lose. I'll wrap it up, and I'll put that in there too. And then the air water thing, the air water bottle container just goes there, and this just flips down over there and snaps shut. Then you can take your suction tubing and just wrap that up, and that just goes right in there too. Close it up, and the unit's closed up. Now if you're going to another location within the country and you're not going through the baggage handlers at the airport, this thing is pretty sturdy. Then you can put all your extra gloves and gauze and mask and restorative materials and stuff in this box, and you can go to the next place just like this. You can carry all your stuff and you're ready to go. All you have to do is open the box, put your stuff out, hook the unit up, and you're ready to go. But when you go back through the airports and the rough baggage handlers, it needs to be protected. So you just put it back in the box. Put a little bit of padding on the top. A couple boxes of gloves works good. Close the unit back up. I put the strap back around it just so that if the baggage handlers open the bag up, nothing gets lost. That just snaps on there. You put the handle down, and you're ready to go in the airport again with a 50-pound bag. Thank you very much.